As Kenya aims to eliminate mother-to-child transmission of HIV/AIDS by 2027, concerns have been raised regarding the new social health insurance fund, which does not cover for HIV and AIDS patients or those with diabetes.
This will mean that as a country we are going to miss out supporting very critical people, more than 1.3 people living with HIV in this country, and about 100 to 120 people who get TB every year. Family planning, if it's excluded from SHIF, that means many more. And it will mean many more unplanned pregnancies, many more illegal abortions, and the consequences that follow in the society.
This development comes even as the government insists that the transition to the new fund is legal and that all Kenyans will soon fully benefit from it.
Sasa hivi wale ambao wamejisajili ni watu milioni 2.3. Siku ya mwisho tarehe 30 Septemba watu waliojisajili ni 1150 kwa siku moja. Jisajili kwa sababu tunanuia kusajili zaidi ya watu milioni 12, alafu ndio tuweze kuwa tumecover hii bima ishughulikie wa Kenya zaidi ya milioni 53.
During a stakeholders conference, it emerged that addressing HIV/AIDS, early pregnancies and sexual violence requires a unified approach, as these issues pose a setback to reproductive health efforts among young people.
The vulnerability of a girl who gets pregnant, drops out of school, if she doesn't get HIV, she then struggles to feed the baby, struggles to get the diapers, she gets HIV because then she begins to have sex for those things. So these things begin to get connected.
For instance, despite Homa Bay County having the highest rates of HIV/AIDS, it also leads in reducing mother-to-child transmission cases.
Kenya is the 4th highest burden of HIV on the continent. If we can succeed in Homa Bay, that tells us we can succeed in Kenya. And when we're succeeding in Kenya, it's a message for the rest of the continent and the rest of the world.
To this end, the government has been called upon to invest more in reproductive health.
We just recently met a boy of 17 years old with 8 children. And we were asking him, so what has it been? Why? And he said, my first child, I got him at 14 years. And as he was trying to describe all these girls he's had sex with, he said that, but they were coming to me because they needed sanitary towels. And so he didn't see his role as being that of a perpetrator. He saw his role as being a giver.
So we really focus on ensuring domestic financing for health across the continent, hence the need for the political commitment in the work that we do.
Robbie Omondi, K24.